Australia is the sixth largest country and has a pediatric population of 4.7 million children, with 51% being male compared to 49% being female. In 2019, there were roughly 306,000 registered births, according to the Australian Bureau of Statistics, with a sex ratio at birth of 106.1 male births per 100 female births. While child rearing in Australia is similar to the United States, there are several differences as well. Most notable is early parenting centers, or what is referred to as sleep schools. Early parenting centers help parents get babies on a sleep schedule. There are both day stay programs and residential programs. Day stay programs are just that, a day where the parent or parents along with the baby work on a sleep schedule as well as play routines, feeding, and settling problems according to the child. In a residential program, the length of stay is longer, up to 5 days or more. There is a family unit with beds, cribs, and everything necessary, including in-house 24-hour support by family and child health nurses. To ensure that help is available to those who may need it, the government subsidizes access to early parenting centers. There are also several safety regulations the Australian government has put into place. Schools and daycares have a strict no hat, no play policy. Children are not permitted to go outside to play without first putting on a wide brim or Legionnaire hat. This is because skin cancer is the most prevalent and costly cancer in Australia. Evidence shows that frequent childhood exposure to UV radiation contributes significantly to the development of skin cancer. However, since childhood obesity in Australia is on the rise, with 1 in 6 children between the ages of 14 and 15 being overweight, there is a push to adopt a no hat, play in the shade policy. The Australian education system provides primary, secondary, and tertiary education. Primary and secondary, or school education, is mandatory between the ages of 6 to 16. Primary school begins at kindergarten and lasts through 6th to 7th grade. Secondary school lasts through 7th to 10th grade or 8th to 10th grade. Senior secondary school are 11th and 12th grades. Tertiary education covers all types of higher education, vocational training, and universities. Tertiary education is largely funded through government research and teaching grants, along with state government funding and overseas student fees. Student contribution varies by field of education, and the Higher Education Loan Program is available to help students whose fees may not all be covered. Australia has implemented universal health care, and the National Framework for Universal Child and Family Health Services promotes health services that support optimal health, well-being, and development. The focus of the framework is to provide optimal health to children 0 to 8 years of age and their families through health promotion, preventative health initiatives, including breastfeeding promotion, immunization programs, child safety, and parenting support. Healthcare is funded through Medicare, the National Health Insurance Program, which receives its funding from both national and state taxes. Private health care is also available. However, the majority of citizens rely on Medicare for their health care needs. Australia's healthcare system ranks second in the world and has one of the longest life expectancies in the world. There is a national Australian immunization schedule with the percentage of immunized 5-year-olds rating at 95.22%. One reason the immunization program is so successful is that children must be up to date with immunizations in order for parents to qualify for Australia's child care subsidy and family tax benefit payments. The Australian National Immunization Program recommends and funds immunizations for children ages 0 to 4 years of age against 13 different diseases. Even with access to one of the best healthcare systems in the world, type 2 diabetes is on the rise in Australian children. This is due in part to a decrease in physical activity of children overall, paired with convenience-type foods. The likelihood of diabetes increases with age, with males being slightly less likely to develop diabetes than females. 27% of Australian children ages 5 to 17 fall into the overweight or obese range when looking at BMI statistics, putting them at risk for developing type 2 diabetes. Lifestyle factors play a major role in development of type 2 diabetes. Since lifestyle factors are a modifiable risk, there are many strategies to lessen the risk of developing type 2 diabetes in children, such as monitoring the child's weight and addressing issues before it becomes a problem, offer and encourage healthy food choices, limiting screen time. The Australian National Physical Activity Guidelines recommend no more than 2 hours daily of non-educational screen time, promoting physical activities and reducing sedentary downtime. The COVID-19 pandemic has created ethical issues related to the Australian pediatric population. Although children have not been seriously affected by COVID-19 ailments, they are susceptible to the economic and social issues created by the pandemic. Ethical issues have come to light from decisions made concerning service restrictions to help control the spread of COVID-19. Many early intervention programs are time-sensitive to rapidly developing children. Hearing screenings can detect issues that directly affect language, speech, and social development. Lockdown restrictions put into place due to the pandemic may prevent these types of issues from being discovered, thus creating a larger problem. Routine checkups not only provide health promotion and disease prevention, they allow healthcare providers the opportunity to assess child well-being, welfare, and the ability to offer support services to families in need while tracking child welfare. Social restrictions in Australia have been shown to increase the need for child protection and family violence support services. While telehealth appointments have provided access to care during social restrictions, not all visits are appropriate for telehealth. Pediatric assessments depend largely on observations of interactions with parents, as well as hands-on physical assessment. This is extremely important with special needs children. Limited access to in-person face-to-face appointments increases the risk of delayed therapeutic interventions and a reduction in the quality of assessment. Fear concerning infection with COVID-19 has also impacted acute care services children may receive. Parents with concerns may delay bringing children into the emergency room. Since social restrictions were put into place, emergency rooms in Australia have seen a dramatic decrease in attendance. As a result, there has been an increase in pediatric deaths from non-COVID-19 illnesses. Although social restrictions have been necessary in the control and slowing of the spread of the pandemic, it is crucial to the health and welfare of children to assess the risks versus the benefits of restrictions frequently.